Hello and welcome back to YouTube channel HealthQ, the place where our mission is to motivate you and help you to move on to the brighter side of the health. And I'm back with another video on children with cerebral palsy. So today I'm going to talk about why you should apply joint compression methods for your child. What are the benefits and how it will help your child? We're going to discuss all of them in today's video. So make sure to watch this video till the end. Let's begin. Friends, joint compression therapy is a very common method that physiotherapists usually prescribe to the parents whose children are suffering from cerebral palsy as a home exercise activity. It is also very commonly prescribed by occupational therapists while they are treating children with different disorders. Now, joint compression therapy has a lot of benefits, and that's the reason it is so popular. So what are these benefits? Let me explain you one by one. Well, at first place, let me tell you what is joint compression. So joint compression is nothing but you pick a joint and you give a forceful compression to that area. That is what is called as joint compression. Now, ideally, all the joints, possibly all the limb joints, requires joint compression as it has multiple benefits. So it's always ideal to apply joint compression at your ankles, at the knee of the child, at the hip level, on hand, at the finger level, at wrist level, at elbow level, and at shoulder level. Now, you must be wondering what is the benefit of doing this or why this has to be done at any place. Well, whenever you are applying joint compression, what you are doing is you are activating one very important sensory system of our body, which is called as proprioceptive system. Proprioceptive system or proprioceptive sense is a kind of sensation that allows us to sense the presence of your joints in relation to the surrounding. Which means whenever we are sitting or whenever we are standing, we know that we are sitting or standing. Despite you close your eyes, still you will know that your knee is bent. You are sitting, you are standing. How do you come to know that? Through touch? No, not necessarily. Not only from touch, but we also get to know this through this simple sensory system or sense that we have got, which is called as proprioceptive sense, also called as joint position sense. Now, joint position sense is a kind of sensation that we are gifted with, which allows us to identify where our joint is in relation to the surrounding. This sensation, when is not functioning properly, you might not feel your presence properly in the surrounding. You cannot judge how much pressure you have to apply while you are holding something or while you are sitting. Sometimes we stand, sometimes we sit, sometimes we stand very strong, but sometimes we stand legs, right? It all depends on this joint position sense. And activating this joint position sense is very important. What happens if this sensation is not well active enough, the input to the brain is not going right, which means the brain does not get enough information on how the joint is placed in relation to the surrounding. Whenever the brain will not get that information properly, the brain will not be able to process that thing properly, and as a result of that, the output, which means the force with which you have to stand, the force with which you have to apply pressure, or the force with which you have to do any movement, that force judgment will not come properly. And that's why a child will either apply very high force, either will apply very low force, and sometimes the child will co-contract, which means he or she will contract two group of muscles both at the same time. When that happens, what will happen is you will see dystonia or a dystonic pattern in the child, which has to be avoided completely. And that's where joint compression therapy comes into the picture. When you apply joint compression therapy to the joints, what you are doing is you are activating these proprioceptive system of the body. Whenever you are activating proprioceptive systems in the body, these nerve endings gets activated, get stimulated. Whenever they get stimulated, brain gets a response that here there is pressure is being applied, here force is being applied, here weight is being applied, which means here more muscles needs to contract in the right way. That will activate the brain, will fire more neurons, and due to firing of that neurons, more motion will happen in a proper way on that joint. And that's what is the purpose of joint proprioceptive system training, or else joint compression therapy. So now that brings me to the next point, where all this joint compression therapy should be applied. As I mentioned, joint compression therapy is required to be applied to most of the areas or most of the limbs of the body, right? So you can apply on the ankle, on the toes, on the knees, on the hips, on finger, elbow, shoulder. Even you can apply joint compression by making the child sit on edge of a pillow or else a chair, and then putting more pressure with the hand through the hip. Even that improves joint position sense at the pelvic region, which is the source of erect posture. So this stimulation can be done by applying firm pressure using joint compression therapy. Now the question comes, how frequently you should do this joint compression. Now this depends on child to child, but ideally doing this daily is a good practice as it improves the awareness of compression sense among child. Joint compression is helpful not only in cerebral palsy, but it is also equally helpful in children suffering from ADHD, children suffering from autism, or any other sensory deficit. Even it's very helpful for children who are going through dystonia or dystonic type of cerebral palsy, as well as ataxia type of or else ataxic cerebral palsy. Hence, this is a very versatile method which can be used by parents at home very easily. If you want to learn more about that, make sure to reach out to us so that we can help you out further. On that note, I'll end this video here and I'll see you in another video. Thank you.